Influenza A H1N1 virus is a subtype of influenza virus A. All influenza viruses, A viruses, have two proteins found on their surface. In April 2009, the CDC identified a novel or new H1N1 influenza virus in patients. This virus had genetic elements from different flu viruses. It was a reassortment of the bird, human, and swine influenza virus. This new virus was passed from pigs to humans. The new virus was able to spread from person to person, and it left us with a perfect setup for pandemic influenza. On June 11, 2009, the World Health Organization raised the pandemic phase level to 6. This level, although it was very alarming to people to hear, which is the highest level of pandemic alert, this level reflects distribution of disease. It does not reflect the severity of illness. Well, it's a worldwide epidemic of influenza. And what is an epidemic? An epidemic occurs when there are more cases of disease than expected. A new influenza virus to which the human population has no immunity. Overcrowded conditions in some areas, and in many countries in this world, people live very close, and diseases are very easily transmitted from person to person. An increase in global transportation. A flu virus is only a plane ride away nowadays. This is 2008, 2009. And we had a peak above threshold in April. And it was something that hadn't been seen before in tracking our seasonal influenza. This influenza-like illness, continued to be above what we had seen in April all the way through, and now you see a huge peak. And this brings us right to October. We're seeing a huge increase in influenza-like illness. And obviously, retrospectively, now we know what we were seeing here was this H1N1.
Now, let's talk seasonal flu vaccine. It's trivalent. Each year they put 3 strains in it. Flu strains to go into the vaccine for the fall are selected in February. Scientists go around the world, they see where the flu is, what strains are out there making people sick. And in February, they have to pick what they're going to put in the vaccine. So, last February, they picked these 3 strains. We have children aged 6 months up to their 19th birthday, pregnant women, people 50 years of age and older, people of any age with certain medical conditions, people who live in nursing homes and other long-term care facilities, people who live with or care for those at high risk for complications from flu, including healthcare workers, that's where I commit to employee health, and household contacts of children less than 6 months. We have a vaccine, monovalent, 1 strain. What happened was, as Karen pointed out, in April we discovered that people were getting sick from this H1N1 virus. And they were getting sick, and it was spreading and spreading, and it was spreading so fast that the scientists didn't want to wait until next year to put it into next year's vaccine, because it was already too late for this year's vaccine. So they said, we're going to make a new vaccine. So this is the only thing in it, monovalent. And if this virus had been discovered before February, it would be in the seasonal flu vaccine that hopefully we all have this year. And we'd all be home now watching the ball game. Pregnant women, highest risk. This morning, they even were identifying obesity as a risk. So it really should say pregnant women and obesity. Persons who live with or provide care for infants aged less than 6 months because they can't get the vaccine. Healthcare and emergency services personnel, that's all of us. Persons aged 6 months to 24 years, that's the risk on Karen's ground. And persons aged 25 to 64 years who have medical conditions that put them at higher risk for influenza-related complications. Same equipment, same egg cultures, same licensure standards that are used for the seasonal vaccines when the strains are changed is just a new strain of the same old vaccine. It's not a new, different, experimental, anything. It's the same old, same old. Safety profile is the same as the seasonal vaccine. It's really just a different strain. Most people who become sick from this H1N1 novel strain recover, and it's a mild sickness. However, people are getting complications and people are dying. Flu shots contain killed viruses, right? Dead, dead. You cannot get flu from a flu shot. If you get sick after a flu shot, you've been exposed beforehand. You might be exposed to upper respiratory. You know, you touch the flu shopping carts and everything. You're exposed beforehand. It cannot give you the flu. Nasal spray contains weakened virus, and there has been no evidence of transmission of that either. Flu shots given to anyone age 6 months or over. The nasal spray given to anyone 2 years through age 49.
If we were to not worry about this flu and allow it to go through unchecked, we have a problem with taxing our resources. There's only so many doctors, there's only so many hospitals, so many hospital beds to go around. There's a loss of income. If you and your family members experience sickness, you miss work, your children are out of school, you miss work because your children are out of school, and yet, or you yourself cannot work. If we allow the flu to run rampant, as mild as it could be, we run the risk of every time a new individual comes down with the flu, it becomes more severe and more infectious. And if we don't begin a campaign of vaccination and teaching the community how to protect yourselves, we may find ourselves with a more severe strain that causes more illness, more death to those around us. And now we're behind the 8 ball because we haven't initiated a vaccine program.